So this is what a night bag looks like, and typically I'm supposed to get one for every night.
Paralyzed from the chest down, Chris Stigas has to use catheters and other medical supplies to urinate. He says he has no choice but to roll the dice on his health every day, risking serious infection by reusing supplies, because the healthcare system won't provide what he needs, and he can't afford to pay for them himself. Without the supplies, he dies.
It's a constant source of anxiety, to always having to consider where I'm going to find funding, where I'm going to find money to take care of if I'm short in my medical supplies.
An estimated 47,000 Canadians with spinal cord injuries use catheters, but Canada's so-called universal healthcare system is leaving many short, say advocates. That's because a patient's ability to get the medical supplies he or she needs depends on what province they live in, or the ability to pay out of pocket.
We are in constant dialogue with our brother and sister organizations across Canada, and this is a common challenge that we've identified across the country with respect to inconsistency of services, different programs, different services, and really very little public policy, right? Like, so part of what we've done in our work is do an environmental scan on what is available to the public and understanding what's available to them. And we've gone from province to province to try to understand what these eligibilities and availability of services are. And they're very inconsistent and hard to determine. So there really isn't a standard of practice across Canada on identifying what is the appropriate need in terms of catheters and related supplies to all IC users, not just people with spinal cord injuries.
Others with spinal cord injuries report intentionally dehydrating themselves to avoid filling their bladders, boiling medical equipment to try and disinfect it, and using cheaper, unlubricated catheters which double the chances of infection.
That seems completely unbelievable that we all live in Canada, and between us there's different levels of coverage for medical supplies when it should be the same for everybody. A spinal cord injury is a spinal cord injury.
For example, Ontario, Manitoba, and British Columbia are among the provinces with the least access to funded programs. Alberta and New Brunswick offer partial coverage tied to income. Saskatchewan, on the other hand, is considered the gold standard by advocates, based on the needs of the patients with no eligibility restrictions.
It makes me feel like I'm a second-class citizen for being on government assistance. There are people that got hurt at work and are on workman's comp. There's other people who are hurt in motor vehicle accidents that are covered by motor vehicle insurance. But if you're on government assistance or government support programs, you sort of get the bare minimum and you have to make up the difference yourself.
But in Stigas' home province of Ontario, the Health Ministry tells Go Public it's not planning any changes. Health Canada isn't either. It says medical devices are the jurisdiction of provinces and territories. Rosa Marcatelli, CBC News, Calgary.